Hi everyone, welcome to the AED Refresher course. My name is Amanda Reed. I am a firefighter EMT in Indiana. On the firefighter side, I am a volunteer. On the EMT side, I do that for my job. That's my career. Um, I am married to another firefighter. We have 3 children, and 2 of those 3 children and my husband and I, are all on the same volunteer fire department. I'm doing this refresher, AED refresher. Some may think it's silly, but to me, I feel I'm a firm believer that training on things is more than about being able to recert when it's time for you to recert your certification. I feel the training on things, whether they be big or small, keeps you fresh and up to date in the field. And I feel that the AED is one that a lot of us rely on the fact that it has pictures or it talks to you. So with that being said, that's why I've decided to do an AED refresher. All right, so the objectives of this course here is obviously know what an AED stands for and what it is, know the need to use an AED, know how to use the AED, and know that training is important and could help not be dependent on those pictures or the fact that it talks to you and tells you what to do. All right, so jumping right into it, okay? What is an AED? So AED stands for Automated External Defibrillator. Why would you use an AED? So we, obviously in my field, the EMT level, and I'm sure those of you watching probably have more of this too, but so we get called to a scene where the patient is unresponsive, doesn't have a pulse. We're going to use the AED for that, right? Okay, so other times that we may use the AED is someone who is unconscious and maybe not breathing properly. We may suggest putting the AED on, because it's going to help us determine, depending on the type of AED that you have, it can help us determine, what's going on there. But it's also safe to have it on just in case we need it, right? So, okay, so someone's unresponsive and doesn't have a pulse. So we're going to put that AED on. It could be used to help restart the patient's heart. However, this does not mean that it will restart the patient's heart every time. So it's very, very important that everybody understands that. As far as AEDs, it would be beneficial for you to look at your department's AED, or if you work in an office, your office's AED, because there are so many different brands, colors, and sizes of AEDs. They should all be labeled AED, but they all do the same thing. If you feel the need to as well, I mean, you can also get on YouTube or Google and look up different AEDs to see the different brands and colors and sizes to know how many there are and what they could look like. Who can use an AED? A lot of people think that an AED is only for those who have some type of certification, whether it be CPR or EMR, EMT, paramedic, doctors, nurses, but that is not the case. The AED is designed to be easy to use. Depending on the brand that you have, it may have pictures showing you where everything goes and how to use it and what buttons to click. It may talk to you and tell you every step of the way what to do. Or in some instances, it may have both of those things. It may talk to you and it may have pictures. So it's good to know that what your AED is going to do. But at the same time, it's also good, like I mentioned before, to train on those AEDs, get those AEDs out, know what they do, um, and what buttons are what, and where is what, and where you attach everything, because you don't want to get dependent on those pictures and the fact that it talks to you, because it can make things so much easier and smoother if you can show up to a call and just slap it on and not pause and be like, oh my, this picture's kind of rubbed off a little bit, or maybe for some reason the voice part of your AED isn't working. I don't know. Things could happen. But at the same time, even if all that is working, I mean, it could still make it smoother if you just can go and not pay attention to the pictures or the fact that, it's talking to you. So with that being said, the fact that they're designed to be easy to use, and they have pictures, and they talk to you, that's why anyone can use an AED. You don't have to have a certification. It's nice, but you don't have to have it. You can literally be at the grocery store and have a job in construction and have never touched an AED a day in your life, and grab an AED that they have there at the grocery store and be able to put it on somebody. They're that easy to use. So, all right. So how do you use an AED? Again, like I've mentioned numerous times, they all have pictures. They talk to you. So pretty self-explanatory. However, again, we don't want to get dependent on those. Okay. So first of all, we're going to get to the patient with the AED. We've had a call come out. We know that the patient is unresponsive. We know that the patient is not breathing. We're going to get to that patient with the AED, okay? So the first thing that we're going to do once we're there with the patient with the AED is we're going to check the patient's ABCs. We have to check the airway, breathing, and circulation. Why would we have to do that if we're already told that the patient is unresponsive and not breathing? Well, you can be told that, but it's always good to double check and make sure for yourself before just slapping an AED or any type of treatment on a patient. You want to double check that and make sure that it's correct and you're doing the proper treatment and doing the proper thing. Okay, so we're going to check the patient's ABCs: airway, breathing, circulation. We have determined that the patient is not responsive. We have determined that the patient is not breathing. So we're going to open the AED, right? Okay, we're going to locate the pads out of it. Once we've located the AED and the pad, once we've opened the AED and we've located the pads, we're going to attach the pads to the patient. So on all of the pads, or most of the pads that I have came in contact with, they do show you where to go. Again, back to that whole picture thing, right? Okay, so but we're doing this refresher course to get out of being dependent on those pictures and those the voices, right? So we're going to attach the pads. Where are we going to put the pads? We're going to put one pad over the right shoulder. I'm sorry, no, not over the right shoulder. Over the right breast near the shoulder. So it's going to go up by the shoulder, right here, over the right breast. The other pad is going to go under the left breast, kind of toward the side, on the side, but right under the left breast, okay? Again, if you get confused, look at the pictures, but let's try to do some training and get out of the habit of that, okay? All right, so we've done that. We've located the pads, we've got the pads on. So now we want to make sure that the AED is powered on, okay? It's not going to do us any good if it's not on. We're going to let the AED analyze the patient. You may have to click the button that says analyze so that it'll do its thing and analyze the patient, and that's dependent on your AED. If the AED advises a shock to the patient, you're going to hit the shock button. But before you hit that shock button, we want to yell clear, and you want to yell it loud, and you want to yell it so that everybody can hear you, because you don't want anyone touching that patient when you deliver that shock, or you're going to have two patients. So you're going to yell loud and clear the word clear, and then everybody should understand and know that that means to hands off the patient, okay? All right, so if the shock is not advised, you're going to continue chest compressions, okay? The AED will let you know when it's time to reanalyze the patient so that you can check, the AED can check heart rhythm again, see if there's anything there, see if anything's changed, see if they decided, the AED decided it wants to deliver a shock this time, different things. So the AED will tell you when it's time to analyze a shock again. When it is analyzing, it'll continue. So you'll analyze the patient, it'll deliver a shock or not deliver a shock. Then you'll go, if it delivers a shock, you're going to remember to check a pulse, okay? Then you're going to go right back into CPR. And then it's like a revolving door. You're going to keep doing it until either one, the patient, you get ROSC, or call the patient. All right, so that is pretty much it. The AED refresher course, it's pretty easy and cut dry. I mean, like I said, they're easy to use. I just put this presentation together in hopes that we can potentially get out of the habit of being dependent on those pictures, and the fact that it talks to you makes things run smoother. So there is a short quiz for this presentation. Everyone should have it. If you have any questions, feel free to email me. Thank you, everyone.